A new treatment for Alzheimer's disease could bring new hope for patients and their families here in Maine.
Yeah, this drug is sold under the name Leqembi. It's been shown to slow the progress of the disease now for patients who are in the early stages. Our Hannah Yeshivi spoke with doctors and patients in Maine to talk about this treatment and what it could mean for them. It's a huge topic. Hey, Hannah.
Hi, good morning, Lee and Chloe. Alzheimer's slowly destroys a person's memory and eventually their ability to do the simplest of tasks. It can also lead to behavioral changes. This new drug, lecanemab, still needs full FDA approval, but for now, it's giving some optimism to doctors and their patients. Don Moore lives in Orono. He's in the early stages of Alzheimer's, and this drug could make a difference for him. Over hot cups of coffee and freshly baked lemon cupcakes. Don and Paula Moore have more than one question for Dr. Cliff Singer, who made a house call on this morning. He's the director of Mood and Memory Clinic at Acadia Hospital in Bangor.
This disease, my mother and father had it.
In your family, clearly there are genes that increase a person's risk.
Yeah.
A few years back, when he was 76, Don was diagnosed with Alzheimer's.
It does seem to be going slowly, but it is increasing.
How do you notice that?
Because I forget things.
Still, Don is able to hold a conversation. He still has good reasoning skills and good mobility.
The Alzheimer's disease, in Don's case, is really limited to an area of the brain specializing in memory, whereas the rest of the brain is still healthy. So if we can preserve those areas of his brain, that would be a wonderful thing.
Dr. Singer says Don is an example of someone for whom the drug lecanemab could work.
Drugs that reduce the burden of amyloid in the brain can be helpful. The lecanemab trials prove that. But it's not a cure. The data suggests that it slows progression over 18 months by about 30%.
According to the Alzheimer's Association, 29,000 people 65 and older have the disease in Maine.
We've got, as a society, difficult decisions to make, whether to pay for treatments that don't improve function, but do slow the rate of decline. Clearly, that's what families and as a healthcare provider, I want. But it's expensive.
Lecanemab costs about $26,000 a year, and Medicare says it won't cover it for now. One of the reasons is because it doesn't have full FDA approval.
It costs so much that you have to wonder for the next few years, is it worth that? Is it really, I mean, seriously, is it worth that?
If Medicare pays, we might think differently. You know, when you want to protect your loved one and keep them going as long as they can, that's...
Dr. Singer says while he doesn't like the idea of Medicare not paying for it, he understands why.
There's going to be compromises in other ways. People will have to pay more for their Medicare. That's going to be a hardship. Or they'll have to reduce reimbursement for other health care.
So for now, Don will focus on doing what he can do now to slow the progression.
So if I need to really remember something, I have to write it down.
He plays chess with at least 6 different people online, eating good because of his wife.
And while laughter can be the best medicine for a lot of things, they'll keep hoping that Don will soon be able to use other drugs in the future that may hold more promise. Even though lecanemab is a step in the right direction, its effects are limited on patients with mild cases of Alzheimer's, which is why medical experts like Dr. Singer are reluctant to prescribe it. You can find more information on this drug on her website. Hannah Yeshivi, News Center, Maine.